Good morning and good afternoon to our members here in the UK and in China. We hope you're all very well, and thank you very much for joining today's webinar in the CBBC Digital Webinar Series. Today we are delighted to announce that we will be presenting with Cisema. Our good friends Anna and Hamish are supporting this webinar today, entitled Opportunities and Regulatory Implications Associated with the Rise of China's Digital Economy in Healthcare. Welcome to everybody. All attendees are muted by default, and as is always the case, please feel free to ask any questions throughout the webinar. We will be having a Q&A session with Anna and Hamish at the end of the session today. So please feel free to input and ask those questions. And if there isn't enough time at the end of the webinar, then we're very happy as well to follow up offline. I'm going to keep this fairly brief this morning because there's quite a lot of content for us to go through. So without further ado, I would like to pass the microphone on to Anna King and Hamish King from Cisema. And as I said, you can see from the agenda there, we will be running a Q&A at the end. So yes, I think let's just jump right into this.
Okay, thank you very much, Jamie, and thank you to the CBBC team for having us again. It's a pleasure. And I just tried to start the video, but it didn't work. But never mind, because we have our faces on the next slide, so you'll see how we look like there. So,
hi, I'm Hamish as well, and we'll introduce ourselves in a bit more detail very shortly, as we just start our video to show who we are for the listeners. But first, we'll just talk about what we are going to talk about in this webinar. And the first section will go in a broader deep dive on China's digital economy in healthcare, where we'll talk about the opportunity set, digitalization, the key healthcare trends, and in particular, some of the COVID-19 tailwinds that have, funnily enough, accelerated the turn to digitalization. We'll then go into the regulatory implications of that, and we'll start with the classification rules, talking about software in particular. Then we'll talk about a few other specificities before we look at a case study.
okay, shortly about Cisema, stands for China Service Management. We are China regulatory consultants. My father actually founded the company in 2002 in the south of Germany and in China, Beijing. We have 11 offices worldwide now and about 100 colleagues. And if you're interested in regulatory updates on a monthly basis, then please let us know by email and we'll put you on our email list.
Now we're just going to start quickly with a poll to see what the audience is most looking forward to in this webinar. So moderator, if you would please put up the first poll where we're asking, what topic are you most interested in? The key digital healthcare trends in China, or how does risk classification work? Are there any fast-track regulatory pathways, or what are the latest updates regarding digital health regulations? Would you mind just inputting your 1, 2, 3, or 4 choices, and then we'll show the results to all, which are anonymous. Okay, thank you. That's the end of the poll. Do we have the results there? Perhaps not surprisingly, people are most interested in the digital health trends in China, but there are a few people also interested in some of the other topics. So that's good to hear. We'll now move into the substantive part of the presentation. And just to keep focus on, we'll stop our video for now, and then we'll restart it a bit later.
China's healthcare market cannot be ignored. Although China's healthcare sector only began privatizing in the 1990s, it is today a vast ecosystem hosting the world's second largest healthcare market. And the fact that healthcare in China is the 8th largest sector by market cap shows that there is still huge potential for growth. The market is growing at double-digit rates for nearly 2 decades now. It is a very large population. It's the most populous country on earth, but not only that, it's also aging. Healthcare expenditure has grown at a staggering 20% annualized rate since 2003 and hit $777 billion in 2018. However, it still represents just 6% of GDP. Whereas in comparison, it represents 17% in the US. So it shows that China's healthcare market is relatively mature when compared with developed market systems. Therefore, there's still a lot of potential. And analysts anticipate that China's healthcare sector will experience higher sales growth versus the US, for instance, and the healthcare industry is projected to be worth 2.4 trillion by 2030. Now I'd like to go on and speak about digitalization. The drive in technology started to conquer really every area of life in China and made it also possible to start the digital health revolution. First, there's the appearance of the internet and the rise of the big three, which are Baidu, Alibaba, and Tencent. The first one, Baidu, in case you're not aware, is basically the Chinese Google. Alibaba sells everything similarly to Amazon, while Tencent introduced the WeChat messaging app in 2001, which is similar to Facebook and WhatsApp and has over 900 million daily users. But technological solutions not only enable Chinese citizens easier communication or shopping or banking, but all these spill over to healthcare as well. And China's central leadership is fostering things like chatbots, artificial intelligence, telemedicine, and cloud-based hospitals. And what we've also included on the slide is the MedTech focus areas of Made in China 2025 plan. And as you can see, remote diagnosis and treatment devices are one of them. And the founder and general manager of Cisema, when he was in China in the early 90s, he used to work in the telecommunication area. He only recently told us that back then there was already talk about remote medicine, telemedicine in China, when he didn't even have a clue or a concept about this. So this is not new to China, and it probably shows why it is so, so advanced. Now I'd like to look at the digital ecosystem in China in healthcare from different angles. And the first one is informed and demanding patients managing their health. Chinese patients are more and more informed about the healthcare decisions. They are more engaged in making them. There are numerous consumer-facing digital platforms that have emerged in the past decade, including digital health websites and apps or virtual patient communities. And these new tools not only change how patients gather and use information, but also offer new opportunities for the industry to influence patient behavior and to support them outside the traditional care setting. For example, in 2017, a big pharmaceutical company joined Ali Health. Ali Health is a healthcare platform of the Alibaba Group to introduce an app where users can take advantage of patient management programs for chronic diseases, and they can also find information about medication safety by scanning a barcode on drug packaging. The next angle would be that the health delivery system is evolving. Traditionally, Chinese healthcare resources have been disproportionately concentrated in very large tier 3 hospitals of major cities and metropolitan areas, and they are not keeping up with the demand. It's often that people with a common cold would go to the highest qualified hospital in Shanghai, for instance, which is not making the best use of the resources, of course. But digital technology is helping to ease the burden. For instance, virtual medical consultations help, as in many Western markets, such digital health tools have been used to connect patients and doctors at a much lower cost and have liberated healthcare system capacity. And some examples I have visualized here on the slide are through WeChat. So patients can book doctor's appointments through WeChat intelligent healthcare to avoid long lines at medical facilities, and following the health checkup, patients can conveniently access their medical reports through WeChat and also pay for medical bills. And WeChat has WeDoctor. There's WeDoctor Healthcare, Insurance, Cloud, and Farmer as well. And another example here on the slide is Ping An Good Doctor. So this is when the search engine company Baidu and one of the largest insurance companies, Ping An, launched the world's leading, China's leading online healthcare ecosystem platform. And the platform cooperates with offline pharmacies, and hospitals to provide users with 24/7 one-stop medical healthcare services, such as online consultation services, hospital referrals, appointments, inpatient arrangements, and medicine delivery. Another angle would be physicians with new channels of communication. The trend of Chinese physicians receiving more professional information digitally is set to continue. Digital tools are a very efficient choice for sales, marketing, and communication with healthcare professionals. Biopharma and medtech companies are learning how to engage physicians either through their own platforms or through partnerships with technology companies, such as Chunyu Doctor. And these virtual platforms are useful to offer high quality medical education and training. But moreover, virtual conferences and live broadcasting have been widely adopted to replace traditional campaigns and events. And global manufacturers of medical devices must get to know not only patients, but also physician behavior in this new era. Affecting a successful launch means targeting doctors and patients alike with the right content through the right platforms. So the next slide is on big data and advanced analytics. China's investment in AI startups fell in comparison to 2017 to $2.9 billion in 2019. So startups in China have been securing a great share of funding deals in the industry in recent years, but the total value of these investments has dropped. And reasons for this are cooling venture capital landscape, but also the ongoing tech and trade war with the US that ripped apart some early stage deals. But the industry is, nevertheless promising. And I've been talking a lot about the use of digital technology to support patient interactions, consumer ecosystems, and ad culture. But now I'd like to have a look at how medical device manufacturers can make use of the digital revolution. And I would like to do that from 3 different angles, representing different paths that companies have taken to add digital technology to their healthcare portfolio. First one is business process improvement. So digitalization is a powerful tool to reduce cost and time on the back end, resulting in improved levels of service and increased profits from efficiency gains in R&D through supply chain management, sales and marketing. And there are some examples. Medtronic, for instance, launched an online business-to-business platform in 2010 to manage a large amount of distributors in China. Roche Diagnostics began remotely monitoring IVD devices, allowing for predictive maintenance and tailored recommendations. And GE Healthcare developed a digital biomarker application to measure the characteristics of Alzheimer patient studies to optimize them, recruit for their clinical studies. The second angle is product service innovation. Companies can improve their offerings through high-impact digital strategies that can range from soft touch development of existing products to innovative and groundbreaking new technologies. For example, GE Healthcare and Trice Imaging, a company that specializes in cloud medical imaging. They partner to develop an integrated cloud-based platform for clinicians to connect with their colleagues and patients, to share electronic health records. And Tencent is developing an endoscopy solution that is able to rapidly analyze endoscopic images for signs of cancer at an unprecedented pace, because colorectal, gastric, and esophageal cancers are major killers in China, but they don't have the resources for one-on-one consultations. So this is very helpful. And Impera GmbH, they developed a smart insulin pen, and Benson Studios is a gaming company that helps radiologists better visualize organ scans. And the last one is disruption with digital, where some companies are finding inspiration in new technologies from completely outside the healthcare arena for disruptive digital strategies that have the potential to revolutionize conventional market needs and behavior.
Now we're just going to have our second poll for the day, where we're just going to ask which of these 3 are you or your company most focused on. And you can choose more than one. And we'll then show the results, and it's anonymous, the choices you make. Yeah, I think that's the end of the poll. Do we have the results there? Please, moderator.
Yes, thank you very much.
So we'll now move on to just look in more detail at some of the effects that COVID-19 is having here, and how they've accelerated some of the trends. And not to be forgotten, learning from the COVID crisis is that digital health is important. Healthcare systems worldwide have been forced to significantly accelerate digital transformation, because keeping people apart is the simplest way to stop the spread of the virus. If people aren't in the same place, there need to be alternative methods to interact and continue to perform healthcare delivery. So there are 2 broad themes relevant that we're seeing in China: telehealth or distance medicine, and using software to assist, supplement, or replace human operators. For telehealth, the key takeaway is that the Chinese government now recognizes payment of prescriptions ordered and medical consultations conducted online for the purposes of reimbursement. And very relevant here is that 95% of China's population is covered by the China reimbursement system. There is a concern about accountability, data sharing, security, the integrity of data, etc., which is nothing new to the healthcare regulatory system. which is why a number of control measures have been introduced. Most noticeably, the concept of an internet hospital designation. Being registered as an internet hospital is a prerequisite for providers to be able to offer online services. But it's still often big tier 3 hospitals, which have the largest and best facilities, that have the designation. Once a healthcare provider is registered as an internet hospital, users can order drugs online and obtain reimbursement. And regular consultation services, especially for chronic conditions such as dermatology, neurology, nephrology, cardiology, are quite frequent. For example, in Shanghai, where there are 13 internet hospitals now established. More recently, Ping An Good Doctor, which Anna had earlier mentioned, which is the Chinese healthcare ecosystem platform, reached strategic cooperation with nearly 50 hospitals across China to jointly develop a new internet hospital model. And its share price has been one of the key beneficiaries since the start of the year. For internet hospitals, there are 3 main operating modes. The online mode for all medical resources of a hospital. The second is the common online integration mode for an alliance of several hospitals. And the third is a platform mode for collecting medical resources. So COVID-19 has accelerated the trend. And Ping An Good Doctor is a good example of how this has happened, where doctors improve medical care by getting second opinion from many other doctors. Software is the other key digital theme and beneficiary of COVID. By digital therapeutics here, we mean software-generated therapeutic interventions directly to patients to prevent, manage, or treat a medical disorder or disease. Medical software is actually subject to the same regulations as other physical medical devices, although they're increasing use not only as standalone software, but also embedded in physical devices presents unique regulatory challenges, which we'll move to talk on about now. So we turn to some of the regulatory implications of the rise of China's digital economy. The broad themes are that the regulations need to adapt to be able to ensure cutting-edge technologies can be certified as safe for medical use. And there are particular difficulties relating to software products, which we'll move to examine in more detail. There have been quite a few announcements recently by the Chinese healthcare regulator, the National Medical Products Association, or NMPA, relating to medical software and AI products, which demonstrates the regulator is trying to adapt and respond to market needs, but there'll inevitably be some lag time between technological advances and regulatory frameworks. Here's a diagram on this slide which tries to clarify some of the terminology used in the context of software. In particular, medical device software is separated into 2 broad categories according to the International Medical Device Regulators Forum definitions, the IMDRF, of which China is a member. China has adopted these definitions into its regulations. So we have software in medical device, also referred to as dependent or embedded software, and software as a medical device, also referred to as independent or standalone software. The characteristics, or the key characteristics of each, is illustrated on the slide. Intended use is key. For instance, software used by a medical device company to design implants would not meet the definition of a device. However, such software, if it was sold to a hospital or surgeon for use in designing custom implants, most likely would be considered a medical device. So a top tip, regulatory tip, is to write a thorough description of the software and its intended use, including site of use, intended users, etc., and compare it to the definition of medical devices. So we're just going to have another poll now quickly. What is most relevant to you or your company? Software in a medical device or software as a medical device? So the result looks to be 50-50. We'll move on now to go into more detail around software definitions, because there's a further subset of software definitions relating to artificial intelligence, which is the key buzzword. AI relates to a machine's ability to take on tasks or make decisions in a way that simulates human intelligence and behavior. Machine learning is a subset of AI that focuses on algorithms, allowing machines to learn and change without being programmed when exposed to new data. And deep learning is the ability for machines to autonomously mimic human thought patterns through artificial neural networks composed of cascading layers of information. These definitions are relevant because of a number of recent guidance documents issued by the regulator are focused on one or another of these subsets. For example, in June 2019, the Technology Evaluation Center of the NMPA released a guidance note called Deep Learning Assisted Decision Making Key Points for Medical Device Software Review. And this guidance applies to deep learning software, but not other categories. And there are a number of instances in guidance documents related to different software subsets.
Before the registration of a medical device can be performed in China, you have to know which risk class your product falls into. And for this, the current medical device classification catalog is extremely helpful. Many product classifications actually changed in August 2018 when a new catalog and its implementation regulations were put into effect. There are 3 risk classes in China, similarly to other countries, class 1, 2, and 3. If you, after you've checked the classification catalog, if you don't come up to a conclusive result, then you can judge according to the rules for medical device classification. And if you're still unsure, there's always the opportunity to apply for an official classification with the NMPA. However, this can take a while. By the way, for IVDs, in vitro diagnostic reagents, they still currently use the classification guidelines from 2013. However, a draft was recently published, but nothing implemented so far.
Yeah, and as Anna has just described the broad outline of the traditional framework, it's important to remember that software as a medical device is still categorized and analyzed under the same broader medical device regulations. So that's always the starting point. For software, there are specific catalog sections where you would look to see where your software would fit. Here are some categories, which we put up on the screen, translated from the classification catalog. Although theoretically it's possible to have a class 1 medical device software, practically we haven't seen it. Note that for software in the medical device, the software will have the same classification as the accompanying medical device. As Anna has already said, if your software does not fall into one of the classifications in the classification catalog, you then need to apply for an official classification with the NMPA. On this slide, we set out a number of standard regulations on medical devices. These are relevant for medical software. So there's the cybersecurity law relating to cybersecurity, software lifecycle process, deep learning assisted regulations, and more cybersecurity regulations, and so on.
Let's have a look at the different application procedures with NMPA. As you can see on the left side, class 1 medical devices, on the right side, class 2 and 3 medical devices. For the initial approval, class 1 has to undergo a filing procedure. Those certificates are indefinitely valid, therefore no renewals are necessary. For class 2 and 3 medical devices, registration has to be performed. This certificate is valid then for 5 years, so renewals are necessary. We advise usually our clients to start early enough in advance, especially if standards have changed, because then it could be, it might be possible that you have to perform some type testing, which can take a while, so you really don't want to miss that renewal deadline. The other types of applications are extensions, which is when one or more new product models are included in the existing certificate. And in contrast to a product change is when you update the characteristics of the approved product and basically override the existing certificate. The old model then cannot be sold anymore. And administrative changes are procedures to, for instance, change the address of the manufacturer, just to keep the NMPA informed. But they're very straightforward.
Yeah, and remember this slide because it is very important for software and AI products, which we'll go on to talk about shortly.
On this slide, you see the general registration process and timeline estimation. Basically, this is a best case scenario. For class 2 medical devices, we usually say it takes 18 months, whereas for class 3 medical devices, around 21 months. That is if there's no clinical trial needed in China. If there is a clinical trial needed, then that could add an additional 1.5 to 2.5 years. I will briefly speak through the different steps. It starts with the collection of registration documents. We provide our clients with document checklists. Most importantly, you always request the IFU, the instruction for use, early on to help us to draft the PTR, the product technical requirements. This is key because this is necessary. This is basically the test specifications, which then help to determine which type tests are necessary in China. Then the transportation of sample follows. Of course, this is only necessary if there is a physical device. If we're talking about software as medical device, then this falls away. But type tests are nevertheless necessary in China also for software. The test engineer will run the software on a normal PC to validate the parameters in the PTR, the product technical requirements. And at this point, I'd like also to mention that in some cases, clinical trials are needed, in other cases not. When writing a clinical evaluation report, it's one of the most crucial parts of the registration procedure. You can base this either on data from overseas, clinical data from overseas is accepted now in China, or by finding information on a predicate device. Luckily, there is also a list of medical devices that are exempt from clinical trials. So it is good to define a clinical pathway strategy early on, actually. And after the registration documents are prepared, we apply, and the NMPA performs their first evaluation, which is followed by a supplementary notice and the preparation of the additional information and documents. Important here to note is that you have one official meeting with NMPA here, and you only have one chance of submitting supplementary information. And should it fail, then you would have to start from the very beginning again. And after the administrative approval, you receive the certificate. And now Hamish will talk more about clinical evaluation of software.
Thank you very much. Software, including deep learning products. must comply with the broader Chinese testing standard, technical guidelines for clinical evaluation of medical devices in order to be registered and marketed for sale in China. There are some subtle differences in how the process works for each category. For software as a medical device, you need to submit clinical evaluation data and justify why any aspects of the guidelines don't apply, because it's not a physical device. You do have the predicate route or the overseas clinical data route available to avoid a clinical trial, however. For software in a medical device, you would submit your clinical evaluation data with the physical device as an entire product. However, it is possible to submit the software separately, in which case you'd go along the same testing and data processes as software, standalone software. For deep learning, the functions implemented by the artificial intelligence algorithms should be submitted for clinical evaluation based on clinical trials. So that's quite important and significant, because as Anna mentioned, if a clinical trial is required in China, that can add a year and a half or more to your registration process. Such clinical trials comply with the relevant Chinese standard, but you can use overseas clinical data, provided it complies with the technical guidelines for accepting medical device overseas clinical trial data. That means it must be a full-blown trial that has ethics approval, wide selection of patients, and all the rest. Thought we'd just have one more final poll now to ask what the audience's view on clinical trials in China, and whether, if you needed to undergo a 2-year clinical trial, would you still proceed with market entry? So, moderator, would you mind putting up the next poll, please? And that's an interesting result. So most people would say yes still. I mean, clinical trials, of course, are a very useful marketing tool to show to hospitals and distributors and the rest. So we'll continue on with talking about legal agents.
Okay, so another topic that I always mention with regards to product registration in China is the choice of NMPA legal agent. So foreign manufacturers have to appoint an NMPA legal agent in China. In the past, there were 2 different roles, a China registration agent and an after-sales agent, but now the NMPA legal agent is a combination of both roles. And if you follow Chinese regulatory changes, you see that the focus is more and more on the complete product lifespan, including also post-market surveillance. And overseas manufacturers have 3 options. First, their own subsidiary, but keep in mind that you need to have sufficient regulatory knowledge and resources. Second, to appoint your commercial business partner in China, your distributor. Keep in mind the NMPA legal agent receives the original certificate, and you need this certificate to import, to modify, change, renew your certificate. And without the cooperation of this person, you'd have a problem, to say the least. But also intellectual property as part of the application goes through this person's hand. And last but not least, a third-party consulting company where you maintain your independence. Also, the NMPA is on the trend of digitalization. They have now also an English website. However, the functions are quite limited still. In May 2019, the Center for Medical Device Evaluation introduced the new ERPS system, the Electronic Regulated Product Submission System. So you see that there are great progress is made in application process management to increase efficiency and reduce application expenses. Also, as of October 2020, actually, the implementation date was set back by 1 year. Unique device identification will be introduced in China. NMPA is releasing batch after batch. Right now, only one batch is available with high-risk class 3 medical devices that have to comply with this. There are some different accelerated pathways in China, which we always get asked about, and I will mention them, but probably burst some bubbles now, because innovative approval and priority approval are quite difficult to qualify for. So difficult that since 2014, only 2 overseas medical device manufacturers managed to register their product through the innovative approval route. Also, emergency approval is only something that is used in a public health crisis like COVID. So there was a window where emergency approval was allowed.
I was just going to add that innovative approval, we will talk about very briefly in our case study, because there was a product approved via the innovative channel.
A Chinese.
A domestic Chinese product.
Yes. And 2 other things I'd like to mention here is Hainan Bao, the medical tourism zone in Hainan, where with the approval of Hainan NPA, medical devices can be imported and sold in hospitals within this pilot zone that are not otherwise registered with the NMPA. And this allows you to gather real-world data that could generate useful lessons for the NMPA when it finalizes its clinical evidence policy. And there's also talk about having to introduce human factor engineering tests in future for foreign manufacturers, and hopefully with help of real-world data, this could be something to avoid. But now I'm just talking about future possibilities. And the other thing is the Greater Bay Area. By listing your medical device in Hong Kong, there will be in future a way to introduce your product into one of, currently I believe there's 27 Hong Kong owned medical institutions in the Greater Bay Area. Just to give you an idea, in the Greater Bay Area there are 21 million people. So this could be potentially another way to introduce your products into China, into the Greater Bay Area. Yeah.
Thanks, Anna. Now we'll just move on to looking at software in a little bit more detail. And one of the particular regulatory difficulties with software is that keeping the registration current through product revisions and updates. It's clearly a key challenge for products such as software that have regular design and utility update cycles. For AI products that change continually depending on data inputs, the challenge is even more difficult. This is because the regulatory framework approves a product for the market at a point in time. Therefore, in principle, any change to the product after that point in time needs to be checked for health safety reasons to determine whether there is an effect on safety and performance. The NMPA's increasing emphasis on whole of product life cycle rather than product point in time approval is recognizing the difficulty, but more work still needs to be done for the regulations to catch up with the technological advances. So I've set out on the slide here some of the minor software updates. What does that mean? A minor software update slightly enhances or corrective software updates, such as improvement to computing speeds, regular security patches, slight modifications of the user interface, in which case this is managed through the quality management system, and no product change to the registration certificate is required. You would, however, need to lodge declaration materials at the next registration filing. So when a renewal occurs or if a later registration change is required. The declaration materials differ slightly depending on whether it's an enhanced update, such as software update description, or corrective update, such as a description of software update regression test plan report, or other description of new known remaining defects. For major software, this affects the safety or effectiveness of the product. The examples can include a change to the computer operating system, for example, from Windows to iOS, or even 32-bit to 64-bit, a change in clinical function, new applications, modes or algorithms, software output changes, user interface changes, or other changes that can affect patient safety. If this happens, a product change application is needed. And that is significant because it's almost equivalent to a new registration. Not as difficult or not as expensive, but the timing is still around 18 months. If such a product change update is required, the documents you'd need are basic information such as software identification, security level, structure function, as well as implementation processes and the core algorithm. There is some guidance, however, for AI products, for products, as I mentioned, that change continually based on the data inputs. An NMPA guideline in June 2019 clarified that for AI software, version naming rules should cover algorithm-driven and data-driven software updates and should list all typical scenarios for major software updates. And a presentation by NMPA in September last year clarified that the risk-based method is the guiding principle in determining whether and when a product change needs to be filed. Therefore, total lifecycle management is strongly emphasized as the method to keep track of safety for users. So this is actually our last slide where we go into a little detail around a product that has all the buzzwords that was recently approved for market in China. It's called Deep Vessel FFR. It's the first Class 3 AI medical device approved by the NMPA in January. Although since Deep Vessel was approved, 2 other Class 3 medical devices, Class 3 AI medical devices have been approved. Software for ECG analysis by Lepu, and diagnostic software for MRI images of intracranial tumors from Biomund. Although we call Deep Vessel an AI medical device, it actually uses deep learning technology that was developed by Beijing Kaya Medical. It performs physiological functional assessment of the coronary arteries non-invasively and extracts 3-dimensional coronary tree structure, computing fractional flow reserve values in minutes from the coronary computed tomography angiography scan, the CTA scan. We've got up here the registration information for Deep Vessel from the NMPA website, as well as a more detail because there was a press release from the NMPA due to its novel registration certificate issuance. It's a Class 3 software as medical device with 5 years validation. It's an innovative product that took advantage of the innovative pathway as the fast track pathway that Anna earlier mentioned. This means no domestic product of the same variety has been registered and listed in China. And actually at the time of NMPA registration, only 1 other similar product globally had been marketed in the US. Also, compared with products of the same variety, the performance index of the product was considered to be at the international leading level. But it's important to remember that Deep Vessel still needed to conduct clinical trials. It conducted prospective clinical trials in 2017 and retrospective clinical trials in 2019 in support of its NMPA application. So the fast track application simply means you get front of queue at the NMPA review process. Doesn't actually allow you to circumvent the requirements. So that's the end of our presentation. And now we'd like to move to a Q&A in the last 10 minutes or so. Moderator, would you like to? Thank you.
Anna, Hamish, thank you very, very much for that presentation. As always, incredibly thorough, very descriptive, and very, very fascinating. I think particularly Anna, when straight from off the bat, when you mention about how your father many years ago had realised quite quickly in China how technology was being adopted at quite an incredibly fast rate, and I think
Jamie, we can't hear you anymore.
We might have lost Jamie there. Perhaps in the absence of his question or questions that he was about to ask, please, if there's anyone in the audience who has any particular questions, submit them in the chat. Oh, Jamie, we've got you back there. We just lost you for a second. Perhaps we can start with a question that's been asked about AI platforms hosted outside China. Do the same rules apply? This is a very good question. Thank you. Well, the first thing to say is the product being marketed in China? If so, then it will need to have registration as per normal processes. I guess what your question is getting at is what happens where the algorithm itself is still based outside, for example, US or EU, so that the algorithm data is collected in China. This is one example. Data is collected in China, and then it is sent or anonymized first, and then sent externally to US or EU. The analysis is done, and a comparison is made versus a large data set of other client data, and then an output is given and sent back to China. That's often, and that's because that process is done just to explain to other users because of the difficulty of analyzing the data, and also because you need all the data in one place to actually run the analysis. And the answer is actually, it depends on the cybersecurity rules, which in China are actually relatively lax compared to other jurisdictions. So in China, actually, it's generally okay for personal healthcare data, if it's anonymized, to leave the country. And so the answer to your question is that should, depending on the details, that should actually be okay for data to be collected in China and then leave the country and then come back again with an output.
I would like to know more about the product, actually, to make a definite answer. So if you contact us by email, then we can give them a specific answer to your question. Yeah, just to add. And also there are changes on a regular basis in China as well.
And as globally, there's more and more of an interest in having, or where the data is located and where it's sourced. So should it be a data center in country, or can it be elsewhere? Yeah, so that's the brief answer to your question, perhaps not so brief.
Any other questions?
perhaps we can ask one ourselves, and what type of registrations, in particular relating to software, are you seeing at the moment, or registrations more general?
I think software is becoming more and more important as part of medical devices. So this is something we will see always, I think, in future. And there is also an increase in software as medical device as well. I'm not sure that was your question, but.
Well, I mean, it is interesting because software is the buzzword, and the healthcare system has been slow to adapt, I guess, but is now very much playing catch up due to the COVID epidemic, which is quickly accelerating development and interest and investments, not only in drug development, but in particular in medical devices and therapeutics and diagnostics. So I think that is the short answer. Jamie, did you have any other questions if you're back online?
I don't know. I don't know if the technology is still failing me. Can you hear me?
I can, yes.
I think I find the potential sort of liberalised policy of provinces like Hainan quite interesting developments. I mean, they're still very much in the beginning stages. Do you anticipate that that's something that will reach full fruition with, you know, foreign brands being able to genuinely step a lot easier into the Chinese market? And do you see Hainan being the first of many of the free trade zones in China that would perhaps look to roll out this kind of easing of policy for foreign companies?
So Hainan is an area that's very interesting. It's kind of a medical tourism zone, what the government created there. It is very popular, and we see that applications to Hainan MPA are going through the roof. You have to keep in mind, though, that you have to find a hospital that's interested in your product, and also your product has to qualify, meaning that it is somewhat innovative or not already used in the market. So they really want to drive the Hainan pilot zone as a platform for really groundbreaking devices. And I think it will probably calm down again within there. However, it's a very interesting thing, and the way that China is introducing new policies often through these pilot zones, and then it is rolled out to nationwide or to other pilot zones. So it's definitely an interesting development to keep following.
Yeah, we should also add, Jamie, that there is quite a bit of detail around, as always, the implementation. But it doesn't, going to Hainan doesn't, for example, circumvent the need to perform clinical trials in China. It's just a supplement. So there was a product that was recently approved. It was one done by the US, or that was owned by the US company Allergan, and there was quite a lot of hype when it was approved. But looking into it in more detail, it actually had clinical data already from overseas, and then it was
conducting real-world data in Hainan.
Because their clinical trial overseas wasn't sufficient for the purposes of China's registration process to obtain a registration. So yeah, we put a little bit of a down there, but it is exciting as well. Yes, absolutely.
Sure. No, it sounds very positive, but of course it comes with some caveats, shall we say? Yes, no, but thank you both for that. I'm just having a look now, and I can't see any more questions that have come through. And obviously, we've only got 1 minute left, so I think that's a good time to wrap things up. So I would like to say thank you to everybody that has joined the webinar this morning or this afternoon, depending on where you are. We will be following up over email with a recording of the webinar. And I would also like to extend a big thank you as well to, of course, Hamish and Anna for their fantastic, as always, presentation today. So everybody, and have a lovely rest of your day or evening. Thank you.
Thanks, everybody.
Bye.